A Senate committee is moving very slowly through those more than 500 amendments to the Baucus health care plan as Democrats push for a floor vote as early as next week.
We're joined now from Capitol Hill by Georgia Republican Senator Johnny Isakson, who has his own presentation, his own bill that he's pushing for. Good to see you, Senator. Thank you for coming in. Now, there's an old phrase from Milton Friedman, free to choose. I always look at any bill and ask the question whether it will make us more or less free to choose in our own lives. Will the Baucus bill make us more or less likely to be free to choose our own health care?
I think it starts a process that will reduce choices. I think most of the legislation that's been proposed, both the Baucus bill as well as the Kennedy bill before it, were really designed to ultimately restrict the availability of resources and move more people towards a government option or a co-op option or some plan like that.
You've been, Senator, a co-sponsor of the Patient's Choice Act back in 2009 that sets to strengthen the relationship, obviously, between the patient and the doctor using choice and competition. But frankly, in the past several years, competition and choice have not been improved exponentially, and certainly all we've seen with costs is that they rise. Don't you agree something has to be done? And in a way, by complaining and disagreeing with everything that's out there, where do we get some solutions here from your side?
Well, first of all, and I appreciate your mentioning the Coburn-Burr bill, which is a Republican bill which does expand access and affordability. So does the Wyden-Bennett bill, which is a bipartisan bill. Both of those bills improve access, reduce cost, and don't raise debt or raise taxes. The problem you've got right now is a thematic push towards a single-payer system. May not call it that, but that's basically what it is. This one's going to have to rise or fall before we can really get some issues to the table that make sense for the American people.
Well, some folks, I mean, if the real question is how do you insure the uninsured, those who should be insured, those who are U.S. citizens, et cetera, which comes down to a base of anywhere between 10 and 30 million people, depending on which data bank you look at. How do you do that without costing the general taxpayer a lot more money?
Well, the first way you do it is by some of those that aren't covered are actually eligible for Medicare or Medicaid, and the government needs a better system of enrolling. That's number one. Number two, some of them don't have insurance by choice. A lot of times it's because of the cost of insurance. And third, there are those people that are independent contractors who really are generally shut out from the market. What we need to do is have competition across state lines. We need to allow associated people to form risk pools nationwide rather than be limited to the states. We need to do away with pre-existing condition and do the types of things that will raise availability and affordability.
It's interesting. I was just talking to somebody who told me that Blue Cross Blue Shield is their carrier, and after their wife had gotten some surgery, that they paid for the surgery, but then they turned down one of the most important drugs that was needed post-op. And we've had Blue Cross Blue Shield on here saying, oh, but we do allow pre-existing conditions. We do this. Don't you think in a way that by getting some type of major reform passed, you might then pressure the big insurance companies to behave in a more proper fashion and that competition would then follow?
Well, I do agree, and I'm not a defender of decisions like that, and I think the insurance industry has a lot of room to improve. But on that example that you gave, I'm working on a case right now in my state with a child on Medicaid who's almost going blind, where Medicaid has rejected the drug the optometrist has recommended to save the child's sight. So rationing is a problem all around, not only just with what exists, but with the government right now in the management of Medicaid.
Senator, there's a more immediate need of a lot of folks down in Georgia right now, all over the South. I'm talking about the flooding that's going on there. What's the very latest on that?
Well, I really appreciate the question. I just got off the phone before I came up here with the Vice President's office. The administration has accepted a declaration on 4 of our counties as a disaster. Expect to have the other 13 done soon. And I will be joining Senator Chambliss flying with Vice President Biden tomorrow to Georgia. One of my home is in the middle of the 3 worst hit counties of Douglas, Paulding, and Cobb. Our hearts and our prayers go out to the families and the victims, and we're going to bring the maximum resources possible under FEMA and the U.S. government to the state of Georgia and the counties that have been so devastated by this flood.
Keep us posted. It is tough, but we're trying to keep the camera lenses tuned to it so the country watches and notices. Thank you so much, Senator.
Thank you very much.
Senator Johnny Isakson from Georgia. Well, will you need 3D glasses to see the future of television?
Intel's chief technology officer